Hey, and welcome. Today, we're diving into something that's literally a matter of life and death in healthcare, but you probably never see it. It's called asepsis, and it's the invisible shield that protects pretty much everyone in a hospital. We're going to pull back the curtain and see how it all works.
You know that scene, right? You've seen it 1,000 times in movies. The surgeon finishes scrubbing and holds their hands up like this. Well, I promise you, it's not just for dramatic effect. It's a critical part of a very strict set of rules, and by the end of this, you'll know exactly why they do it.
So, at its heart, a huge part of modern medicine is this constant battle against an invisible enemy. We're talking about germs, or, microorganisms. And our main game plan in this fight is a concept called asepsis.
So what is it? Put simply, asepsis just means being free from all those nasty disease-causing contaminants. That's the goal. Everything we're about to talk about is designed to create and maintain that state of clean. Now, this fight isn't a one-size-fits-all kind of deal. Depending on the situation, healthcare pros use two totally different levels of defense. You've got what's called the clean technique and the sterile technique. Let's jump into the first one.
All right, our first line of defense is medical asepsis. You'll also hear it called the clean technique. Just think of this as the foundation for everyday patient safety. It's happening all the time.
Okay, the most important word on this slide is reduce. We're not talking about eliminating every single microbe in the room. The goal here is just to knock down the number of germs so they can't cause an infection. It's all about risk reduction. And you see this clean technique everywhere in basic patient care. Giving a patient their pills, helping someone with personal hygiene, or managing a nasal gastric tube. That's a feeding tube that goes through the nose. All of these things need to be done cleanly, but they don't have to be perfectly sterile. So, what's the number one most important, absolute cornerstone of medical asepsis? It's this: meticulous hand hygiene. Yup, good old-fashioned hand washing. It sounds so basic, but it is hands down the most effective way to stop infections from spreading. And when we talk about effective hand washing, there is a magic number you need to know: 15. That's the absolute minimum number of seconds you need to be vigorously scrubbing your hands to actually get the job done. So a proper hand wash is actually a full-on protocol. You've got your 15 seconds of scrubbing, of course, but here's the step most people miss, and it's a game changer. You use that clean paper towel to turn off the faucet. Why? Because that faucet handle is dirty. This one little move keeps you from immediately recontaminating your perfectly clean hands. Okay, so that's the clean technique. That's our baseline. But what about when we have to go way beyond just clean? When we need an environment of absolute purity? Well, that's when we level up to surgical asepsis. And the key word here is eliminate. We are not reducing anymore. Surgical asepsis is about creating a zone that is 100% free of all microbes. This is the sterile technique, and the rules are intense. This chart lays it out perfectly. On one side, you have medical asepsis. The goal is to reduce microbes, you use it for general care, and hand hygiene is the star of the show. On the other side, surgical asepsis. The goal is to eliminate all microbes for things like surgery, and its core principle is something called the sterile field. And this is the first commandment of the sterile field. It's simple. If an item is not sterile, it cannot enter the sterile field. Not even for a half second. There is absolutely no 5-second rule here. Rule number 2 is all about constant vigilance. The second you turn your back on a sterile field, you have to consider it contaminated. Why? Because you can't be sure something didn't drift into it or touch it. You've got to keep your eyes on the prize. Okay, so moisture is the great enemy of sterility. If a sterile wrapper gets wet, it's game over. That's because of a process called wicking, where microbes can literally travel through the moisture from a non-sterile surface up to the sterile one. So keeping that field dry is critical. And here it is, the answer to our big question from the beginning. In surgical asepsis, there's a recognized safe zone. It's from your waist to about your chest. Anything held below your waist is considered contaminated, and anything above your chest is too, because you can't easily see it. So, surgeons hold their hands up to keep them right in that safe, sterile zone where they can see them. So, it's one thing to know the rules, right? But putting them into action is a whole other thing. It's this incredibly precise ritual, from the way you open a package to how you put on your gloves. The very first thing you need to know about this ritual is this number: 1 inch. The outer 1-inch border of any sterile package is always considered contaminated.
It's like a little buffer zone between the sterile world inside and the non-sterile world outside. Opening a sterile pack is like a tiny, careful dance. You always open the first flap away from you. That way your arm never has to cross over the sterile field you're creating. Then you open the sides. And finally, you pull the last flap down towards your body. Every move is designed to protect that sterile space.
Putting on sterile gloves is just as precise. With your bare hand, you're only allowed to touch the inside cuff of the first glove. But once that hand is gloved and sterile, you slide your fingers under the cuff of the second glove, touching only the sterile outside. It's a brilliant little system of sterile touching sterile and non-sterile touching non-sterile.
So we've walked through the clean technique and the sterile technique. We've seen all these rules and rituals, but let's zoom out for a second. Why does all of this incredibly tedious detail matter so much? This is really the whole point. Before we understood these principles, surgery was often a death sentence because of infection. It's this disciplined, almost obsessive focus on the details that changed everything. The gap between just reducing germs and truly eliminating them is what makes modern, life-saving surgery possible.
So we've just unmasked this hidden world of asepsis. And it kind of makes you wonder, doesn't it? What other invisible, super complex procedures are happening all around us, keeping us safe every day? In hospitals, sure, but what about on airplanes or in the food we eat? Definitely something to think about. Thanks for joining me.